Today we will be talking about good patient issues. Today we are going to learn about managing a COPD or other pulmonary exacerbation. The definition of an acute exacerbation is the new onset of more than one respiratory symptom such as cough, sputum, sputum purulence, wheezing, dyspnea, lasting 3 days or more and requiring treatment with an antibiotic and/or a systemic corticosteroid. Signs and symptoms of an exacerbation may include an increased respiratory rate, possible fever, high heart rate, worsening oxygen levels, worsening shortness of breath, more or less sputum production than your normal, chest discomfort, overall weakness, and possible confusion. The most common cause of an exacerbation will include an infection, whether it's virus or bacterial. Other triggers for an exacerbation may include sudden or seasonal changes in the environment, bitter cold weather or heat and humidity, irritating dusts or odors, chemical fumes, mold, pet dander, and non-compliance with our inhalers. Specific to an infection, we may notice an increase or decrease in our sputum production, an increase in the thickness or the stickiness of our sputum, a change in color of our sputum, possible fever and chills, and increased shortness of breath. Specific to bronchospasm, we may notice an increase or decrease in sputum production, an increase in thickness or stickiness of sputum, increased shortness of breath, and wheezing. Specific to some symptoms of heart failure, we may notice an increase or decrease in sputum, frothy sputum, so the texture is a little different than usual, an increase in shortness of breath, the need for a pillow or to sit up when we are trying to sleep, any sudden weight change or weight gain usually, swelling of our ankles, legs, or around our eyes, and any chest pain, palpitations, or change in our resting heart rate. Specific to dehydration, we may notice a decrease in sputum production, an increase in the thickness or stickiness of our sputum, unexplained weight loss, in dark urine, or dry mucous membranes and skin. Other symptoms we should be aware of include frequent morning headaches, loss of interest in surroundings, insomnia or daytime drowsiness, confusion, disorientation, slurring of speech, and difficulty awakening. Some of these things might be reflective of changes in our blood gases, specifically our oxygen and carbon dioxide levels, and concerns of stroke. It is important to stay in contact with your physician's office when you recognize that you are using more than your usual number of puffs of your short-acting bronchodilator, or you find that your short-acting bronchodilator does not last as long as usual or does not seem to be working at all, or if you think you are getting a bad cold or chest infection, or if you have recognized low oxygen levels with your home oximeter. Other important reasons for you to be in contact with your physician's office include if you have noticed that at least 2 of the following symptoms have occurred with or without a fever: increased shortness of breath, increased volume of sputum, or a change in the color of your sputum, such as that of green or yellow. Or you find that you may be deliberately avoiding activities that you used to enjoy because of increased breathlessness. The COPD Action Plan is a nice tool for you as you pay attention to how you are feeling. If you have worsening symptoms or an exacerbation or a flare-up, you may need to see your primary care doctor right away to identify and treat the problem. You can use this 3-colored table to quickly understand how you are feeling and what to do. We have the green area for when I feel well Here you may list medications that you are routinely taking for your breathing. The yellow area, where is for when I feel worse, you might have additional medications listed here depending on the type of symptoms that you now have developed. When I feel much worse, in the red area, those are directions for what you need to do when you are really having quite an exacerbation. It may end up being that you do need to call 911 in that red area. The back of the action plan also highlights ways for you to keep important numbers at hand. You can list your emergency contact person, a primary care doctor, your pulmonologist, your oxygen supply company, so those are all handy for you at the time of need. If you find yourself having increased shortness of breath or an exacerbation, it is important for you to remember to stay calm. Having a slower respiratory rate will help you feel like you get more volume to your breath and help you relax a little bit. You would want to use your pursed lip diaphragmatic breathing to help control any anxiety that you might have related to your breathlessness. Cold weather is also a factor for many people who have lung disease. Wearing a mask or scarf over your nose and mouth whenever you go outside is highly recommended. We want you to keep your oxygen tubing inside your clothing. You can also have someone preheat your automobile before you get into it. Drinking a warm glass of water slowly when returning indoors is also very helpful. When one has an exacerbation, oftentimes it's a decision whether I should go into urgent care or an emergency room. So always having a transportation plan in place is very helpful for you in the future. Sometimes you would need to keep in mind that it's very stressful, not only just for you, the patient, but also for a friend or family member who would be driving you to the hospital or urgent care. So take that into consideration as you develop your transportation plan. Once you have recovered from an exacerbation, you would want to rethink about what happened during that time that I became so sick. So when you have your follow-up visit to your physician, you should discuss with them what was the emergency that seemed to occur. Was it that I missed my medications? Was it that I was exposed to someone who was sick, such as a grandchild? And could it have been avoided? Could I have intercepted it a little sooner so maybe I wouldn't have got quite so sick? And just really confirming exactly what happened to you. So in conclusion, we want to reassure you that with COPD and other pulmonary exacerbations, they are typically brought on by respiratory tract infections. They are characterized by an increased cough and mucus production, change in mucus color, shortness of breath, and possibly wheezing. On average, persons with lung problems experience an exacerbation once or twice a year. Now we just have a little short knowledge quiz about the information that we discussed here. Please read through each of these 2 questions, try to answer them, and the next slide will provide you with the correct answer.